Magandang araw sa inyong lahat. I hope that you and your loved ones are fine and in good health. So, for this e-learning video, gusto ko lang i-cover yung mga topics which I think are very important, which we missed out during class. So, this is about social work practice models. Now, this graphic shows, in a nutshell, the social work profession, which comprises of three major components. One is the philosophical and value foundation, which we've been able to cover during our class, and the knowledge foundation of social work practice, which includes key theoretical foundations, and you've been able to cover those in your reports. For now, we will be focusing on social work helping models and approaches, which is the third component of the social work profession. How do we integrate the knowledge that we have learned and the ethical values that we know into the practice of social work? Ano-ano yung mga models and approaches which we use in helping individuals, groups, and communities. This is an overview of the social work practice models that are useful in Philippine setting especially. I'm just going to focus on 10 practice models, which I will be discussing one by one in the course of this video. Unang-unang model is the direct provision model. This is also called the resource provision model. As the word says, it aims to enhance clients' social functioning by providing material aid and other resources. Examples here are cash assistance, shelter, and medical care. So, do the social workers carry out this kind of model? We have to consider the fact that yung poverty situation in the country calls for a lot of direct provision in various forms of material assistance. So this is in response to the context that we have in the Philippines where poverty is everywhere in the country. Maraming nagsasabi na yung direct provision model daw is a form of dole out and that it promotes dependency among the poor. Hindi daw siya nakakatulong in the long term because it doesn't empower the marginalized. It just depends on the charity that's been given to them. Do you agree? Sa social work practice, the answer is no. Why? Because when you do direct provision properly, it has to go through a systematic helping process. Meaning, you have to have an assessment, planning, plan implementation, evaluation, and termination. So, at the back of your mind, um, the helping process does not end by giving the material benefits, but it requires some sort of an empowerment of the people that we are helping. Ang usap-usapan ngayon, as you know, with the COVID pandemic, is the Social Amelioration Program of DSWD. And I think maybe some of you are involved in this cash emergency subsidy program for 18 million Filipinos affected by the pandemic. So each qualified family can receive at least 5,000 to 8,000 per month. And this is a form of direct provision model. And I don't think we can call it a dole out, and I don't think it will cause dependency among the poor. It is a necessity during this time of crisis. After the direct provision model, we have the intercession mediation model, which involves negotiating the service jungle for clients. Why is it called service jungle? Basically, because there are a lot of programs and services out there that are offered by the government or NGOs, but the clients are not aware of these. So, ang role ng social worker is to connect the client to the needed services. Sa model na ito, yung social worker plays a variety of roles. Helper siya, pwedeng interpreter, facilitator, negotiator, to ensure na makarating dun sa client yung necessary na service delivery. Ito ay isang halimbawa ng intercession mediation model. In this case, the client has been dismissed by his company. He works as a driver because of his physical disability, which happened due to an accident. So, yung social worker intercedes on behalf of the client by pushing for the payment of his disability compensation. So, it requires dealing with company policies as well. Yung social worker also help the client to have access to affordable medical service to help with his disability. In this case naman, ang kausap ng social worker are medical practitioners and public health clinics and offices. So this time, the social worker plays different types of roles on behalf of the client. Ang pangatlong model or approach is yung tinatawag na mobilizing the resources of client systems to change their social reality. Problems are not always due to personal inadequacies. So, bilang development workers, we understand that it's not always because of the client's weaknesses kung bakit kailangan niya ng tulong. But also, we have to acknowledge the deficiencies in the social reality. Meaning, if we want to help individual, group, or community, we also have to change or help modify the social reality. The social worker helps, guides, or enables the client with the use of the client's resources to change his social reality. So, yung key dito is using the client's resources. Sa isang pamayanan na walang source of clean water, paano mo matutulungan yung mga tao? Without clean water, it affects their health conditions, their hygiene. So, bilang social worker, you can guide and enable the community to mobilize their members, to use their resources, to be able to install clean, accessible water system. In this case, nagkaroon ng mas long-term na solution by changing the social reality of the people that you're helping. The fourth model is crisis intervention. Ano ba yung pagkakaintindi natin ng crisis? And we are all in a crisis situation at the moment, and we understand that it is an upset in a steady state. Crisis intervention in this case is a process for actively influencing the psychosocial functioning of individuals and groups during a period of acute disequilibrium. It involves time-limited work, usually which happens for 2 to 6 weeks. And normally, It is used in emergency ward of hospitals, women's desks, in police stations, and during situation of natural disasters. And right now, this is an important model that social workers are using. This is an example of a crisis intervention model. And this is a community in Metro Manila na tinamaan ng Typhoon Ondoy. And as you can see, the families have been uh, shattered, yung homes nila and other properties because of the typhoon. And in this case, very relevant yung crisis intervention model. The fifth model is what we call task-centered model with groups. Based on the name of the model itself, it's task-centered, meaning it is designed to help clients and social workers collaborate on specific, measurable, and achievable goals. Meron siyang concrete goal na gustong ma-achieve through group work. The steps here involve identifying the client's problems, outlining goals, creating and executing a task-centered plan, and evaluating the results. Yung task-centered model is usually used in the context of families. And one example is for families which have irreconcilable conflict, and yung social worker tumutulong para magkaroon ng better communication yung mga family members. So, the first thing that the social worker does is to come up with a measurable goal for the family and to try to work and come up with activities para ma-achieve yung goal na ito. So this is an example of a task-centered model. Ang pang-anim na model ay tinatawag na Psychosocial Approach. It explores the physical, psychological, and social aspects of the client and their situation. So yung client natin, hindi siya nalalayo doon sa sitwasyon niya. A social worker should have this kind of perspective. Yung pag-assess ng problema, kasama doon yung pag-intindi natin ng sitwasyon ng client. So, ina-assess natin yung kalakasan niya in meeting financial and other basic needs, yung relationship niya with families and other social support. Pag naiintindihan natin yung ganitong sitwasyon sa buhay ng clients natin, then we're able to identify and develop interventions to improve their functioning. So that's the psychosocial approach. Madalas gamitin yung psychosocial approach sa health situation, mental health, child protection, helping the aged, disability, and addressing family violence. So, malinaw yung emphasis ng psychosocial approach is to understand the situation of the client system. Ang pangpitong approach na pag-aaralan natin ngayon ay yung behavioral modification model. It improves the social functioning of the client system by helping them learn new behavior and eliminating problematic ways of behaving. Yung behavioral modification model is commonly used among children who need help. It is based on behavioral theory. people repeat behaviors that are rewarded. So kung yung isang behavior nagkakaroon ng positive results, then we would go on doing that. And then we also have to recognize that behavior is shaped and patterned by its consequences. Do you know that diarrheal disease due to poor water, sanitation, and hygiene, or WASH, kills more than 1 million people every year? So, hindi sapat na magbigay ka ng water supply sa pamayanan. You also have to change their behavior. So, yung mga gantong proyekto, WASH projects na sinasabi, they use behavioral modification to improve personal hygiene and also to promote healthy lifestyle among community members. Kailangan ng pagbabago sa behavior on how they take care of their hygiene and also sanitation for a WASH project to be successful. Yung pangwalong model na pag-uusapan natin is what we call the Interactionist Approach. Dito pumapasok yung person, situation, interaction. The social worker mediates the process through which the individual and society reach out to each other through a mutual need for self-fulfillment. Patuloy yung proseso ng interaction ng isang tao sa sitwasyon niya. So, a social worker needs to be sensitive and be aware of this kind of interaction. Yung 3 assumptions under the interactionist approach is that number 1, human beings respond to objects, a thing, an idea, an event, or a person based on the meaning they attribute to those objects. A Starbucks coffee, for example, could have different meanings to different people. And yung pangalawa naman, the meaning a person gives to an object emerges from his or her social interactions. And then, these meanings are used, understood, and modified. So, patuloy yung proseso ng pagbibigay ng meaning sa mga objects or symbols. And the social worker needs to navigate through this process sa kliyente niya or individual or groups, and then the system kung saan gumagalaw yung clients. Isang application ng interactionist approach is when a social worker worked with low-income Hispanic residents in Los Angeles. The social worker was able to understand the residents' personal identity, their relationships, the situation as they experience it. Through the interactionist model, the social workers are able to delve deeply into understanding a client's quote-unquote membership languages and empowering him or her to solve problems. I think it's also relevant when we work among indigenous people groups. We have to understand the meanings and the relationships that they have in that particular group to be able to come up with effective helping intervention. We are now on to our 9th model, and this is the remedial approach. This particular model gives a lot of emphasis on group work. According to Robert Vinter, group work is a social treatment. It's a form of a social treatment to help members of the group. Ang premise nito is that individual change can happen through small groups activities. And it uses a guided group processes in treating and rehabilitating individuals whose behavior is disapproved. It also sees the group as a small social system whose influences can be guided in planned ways to modify client behavior. Yung mga examples dito, yung mga Alcoholic Anonymous, yung may mga problems sa addiction, group work is used in these situations. And of course, we should not forget yung visit natin sa Ina Healing Center, which also uses a lot of group work activities to help grieving mothers. The 10th model is community organizing. This is a process where people come together into an organization that collectively acts in their shared self-interest. It also generally assumes that social change necessarily involves conflict and social struggle in order to generate genuine power for the powerless. Itong process na ito ay lumakas especially during the martial law period when poverty situation called for organizing communities into action. And later on, we will discuss the other 3 types of community organizing. We have 3 models of community organizing. The first one is a locality development. The second is social planning. And the third is social action. Locality development is also understood as community development, meaning community change is achieved through broad participation of people at the community level. Para ma-achieve yung self-reliance, ma-achieve yung collective goals, we need to have genuine participation at the grassroots level. The United Nations defines community development as a process where community members come together to take collective action and generate solutions to common problems. So this is the first model under community organizing. The second model under community organizing is social planning. This is a technical process of problem solving to respond to social problems such as poverty, health, housing, and others. It acknowledges the fact na yung pagbabago sa isang environment requires expert planners who, through the exercise of technical abilities, can skillfully guide complex change processes. And I think sa situation natin ngayon with the pandemic, we rely a lot on scientists and experts on how to move on and how to plan ahead. Kailangan bang ma-extend yung ECQ, for example? So, there are a lot of experts that contribute their knowledge and skills to come up with plans to solve social problems. And social workers have a role in this as well, in developing programs to address iba-ibang situations. So social planning is also an important component under community organizing. The third model under community organizing is social action. This model harnesses collective power to leverage positive change for communities. iba't ibang pamaraan ang ginagamit for social action. If we want to change certain policies, iba't ibang ways to influence policymakers. Basically, the goal of social action is to redistribute power and resources, expand democracy, and create a just and equitable society. Maraming strategies to do social action. And if you look at the situation that we have now with information and communication technology, a lot of social action activities take place through social media. In the olden times, people would go to the streets, and I think until now, people still go to the streets, but actively we use online communication to help influence policy changes. So that's social action. We have been able to discuss briefly the different social work practice models. This is just an overview, and if you're interested in learning more about specific model, you can just send me an email. I can provide you with more information. But these models, you will still be encountering them sa mga susunod na classes ninyo. So I think it's useful for you to be familiar with these social work practice models. Again, there are 10 models that we have discussed through this video, but there are more models. I just think that ito yung pinaka-relevant sa social practice natin today. So I hope that you learn more about how to do all of these approaches in social work. And I think sa mga practices ninyo, you're able to apply these already. Sa context ng pagtulong sa mga bata, for example, we have behavioral modification, task-centered, yung those in DSWD have been using a lot of direct provision, also crisis intervention, psychosocial approach. So I would encourage you to read more about these models, and the next thing really is developing the skills to carry out these models. As a closing slide, gusto ko lang kayo na mag-reflect on what type of model will we will be needing in the next years to come. Anong klaseng skills ang kailangan natin to be able to be more effective and relevant in the practice of social work. And I'd like to share with you this statement from the Secretary General of the International Federation of Social Workers, Dr. Rory Truell, and sinabi niya, in all mass crisis situations, the world will not be the same as before. As a profession comprising millions of highly skilled professionals, the social work voice must support and facilitate a vision beyond this crisis, a vision of better, respectful, and sustainable societies. Social workers at every level have the skills and capability to not only address safety for today, but to translate fear, grief, and loss into empowerment and social transformation. I think with the crisis that we are experiencing now, nag-evolve yung role ng social workers. Ano ba yung mga practice models na kailanganin natin? Ano ba yung mga skills na kailangang ma-develop ng social workers to be able to help come up with better, respectful, and sustainable societies. We have a lot of work to do. So I'd like to end the video with this slide. Thank you very much.